11 weeks ago, Rispa walked into our clinic. She's in labor. It is 6 p.m. and raining. You know, rains are not welcome in Kibera. They make our lives difficult. The roads impassable. And you know, as our structures are made of tin roofs, it makes the nights cold and wet. I examined Rispa and realized that she has a twin pregnancy. I wish I had an ultrasound system to confirm this. After some time, I noticed that one of the twins is lying in an abnormal position. I have to rush Rispa to the nearest referral hospital. Otherwise, risk losing 3 lives, hers and that of her unborn babies. At this time, one thing rings to my mind. My next major project is to own an ambulance. With no option and the rains pouring heavily, we opt to hire a taxi. No taxi is willing to come into Kibera with the rains. Fortunately, Kamau, who is a frequent taxi driver and assists us in this work, agrees to come over. And with the help of the community, with the boys in the community, we lift Rispa up onto the taxi and we transfer her to Kenyatta National Hospital. Rispa is lucky. Ladies and gentlemen, do you know that out of every 10 women living in the informal settlements, 8 of these opt to have a home delivery? Not out of choice, but it's because they cannot afford it to go to a proper healthcare system. Rispa today is holding her healthy babies. I can attest to this because prior to opening Senye Clinic, I was working at a major referral hospital, and I could see many pregnant women coming in with complications. Some of these could have been prevented if they had proper antenatal care. And I knew I could come to their aid. After acquiring my master's degree in public health, I sprang into action. I resigned from my well-paying job, took a loan from Jamii Trust and Kenya Women Finance Trust in 2004, and opened a clinic with a bed capacity of 3 and hired 1 nurse to aid me in doing this job. And soon the clinic was becoming congested and crowded. What surprised me is that there are many NGO facilities which were offering free medical services. It was this kind of cost-sharing model that enabled Senye Clinic offer quality and affordable health care which was accessible to the people of Kibera. As time went by, and I continued to serve in this community, so did their trust in me grow. And this was manifested in 2007 when we had the post-election violence. Most of the NGO, in fact, all of them were closed for fear of their lives, but Senye Clinic was opened. And I am glad to say that wounded men, women streamed into the clinic, and we were able to offer proper health care. I'm glad to say that we offered a beacon of hope amidst this kind of chaos. In 2009, we expanded our facility to a neighboring house, which could accommodate 20 beds. However, we had to make the cost of running the facility viable and rented out 14 of these, and we were left with 6. But I'm happy to say that at least it's double with what we started with 7 years ago. In summary, my journey with Senye has not been easy. Many a times, I have struggled to ensure that all the costs are catered for. However, the people of Kibera are my people, and I know I can lend a hand despite the challenges that poverty poses. My vision is that one day, Senye will have the equipment and the expertise to cater for these complicated cases. This journey is quite fulfilling. Let us work together and remove the barriers that for so long have hindered our progress and emancipation. Join us in doing this work. We can make a difference. Thank you.